Hey y'all, this is Taya. Welcome back to the Chicago Birthworks Collective YouTube channel. I am so glad, I feel very honored to be talking to you about cervical exams. It is really my honor. Lots of women experience cervical exams, and I'm about to break down all of the details that us doulas know that you need to know about cervical exams, why they happen, what folks are looking for, why do people have to dig around in your vagina anyway, how long have people been doing this, is this even evidence-based, do I have to let somebody stick their fingers in my vagina, all of that stuff and more. Let's get into it. Alright, so before we get really deep into what happens in a cervical exam, we gotta take it back. So y'all get your student vibe on, okay? Put your student hat on. I'm about to teach you, take you all the way back through some history. We're not going all the way back. We're gonna go back to maybe the beginning of like Western medicine. So folks knew, because they palpate and also because of autopsies, but they would palpate the stomach and they knew, okay, there's this ball. There's this place where the baby is inside of. Boom, it's a uterus. And there's also this small little opening at the bottom of the uterus, which we know as the cervix. So that is the kind of stopper of the uterus that goes into the vagina. So when you're traveling up your vagina, let's say I'm a little sperm guy, right? I'm trying to catch me a baby. I'm traveling up the vagina and boom, I stop because I meet the cervix. And the cervix is what separates the vagina from the uterus. So it's this very, very, very tight section of tissue. It's attached to your uterus, and it does a lot of hard work in protecting your baby, protecting everything inside your uterus. So even when you don't have a baby growing inside your uterus, your cervix is working to make sure everything that happens in your vagina doesn't happen inside your uterus also. Because everything that goes into your vagina, you don't want in your uterus. So it's very tight. It's usually closed. When you have your cycle, when you menstruate, it's going to open up just enough to let all that blood out. So it does dilate on the regular. If you have a regular cycle, it's always changing. So because they knew that the baby had to pass through the cervix, they thought, wow, if we could just get a better picture of what's happening with this cervix, y'all, boom, we are in there like swimwear. And so folks started to try lots of different things to get a good assessment of what was happening with the cervix. And there were some particular things that they were looking for. They wanted to know how wide open is the cervix at any point in a woman's labor. They wanted to know how soft or how thin it was, and then also feeling through the vagina if they could see where the baby was in the pelvis. So if the cervix is at the bottom of the uterus, by touching the cervix or kind of feeling through the cervix, they should be able to tell where the baby is. Do I feel that baby's head at all? And then where do I feel that baby's head while I'm in there kind of feeling around? And you're seeing me do this because initially folks thought the best way to get to the cervix is straight through the vagina. And so there was a widespread practice of vaginal exams to assess what was going on with the cervix. But sometimes people felt like this might be increasing the risk because the cervix is there to stop infection, to stop germs and any unwanted things going into the uterus. Maybe we're increasing the risk by sticking our fingers up there and touching the cervix. And we know way back then, there were not gloves. So we were just trying to wash our hands as much as possible. I say we like I was there, I wasn't. But folks were just trying to wash their hands as much as possible. And they started to see that there was some type of increased risk of infection. So some smart person thought, why don't we go through the rectum? That's right. If we just stick our fingers up the rectum, because the rectum is close to the cervix, we'll be able to assess generally the same amount of information. Does the cervix feel like it's open? You know, all those things are just tissues that are close to each other. Does it feel like it's open? Does it feel like it's getting softer or thinner? Is it more stretchy? And then you can also feel usually where the baby's head is. And so people started practicing doing a cervical exam through the rectum. But women said this is too uncomfortable. It's very uncomfortable. And they also thought there was an increased risk because now you're inserting fingers into the rectum. So any type of bacteria that's on the outside, on your butt, on your anus, is now being pushed inside your rectum when things usually come which way? Out the butthole. So because women started to advocate for themselves, and there were midwives who were practicing under the recommendation of these male physician scientists, the midwives were saying this is just not comfortable for a laboring person. So they started trying to find another way. And what happened was people started coming up with instruments. They started looking into creating small instruments that you could attach to the cervix that would give you an external indication. It looked like a kind of weird contraption because people knew if we can just get an idea of what's happening with that cervix, it will give us just goggles into the future. This is how amazing your cervix is. But all in all, it caused so much controversy on which way we should be assessing the cervix, how we should be doing it, how long, that some folks started saying it's not necessary at all to assess the cervix. We don't need to know how far dilated someone is, how soft their cervix is, because it's not going to change how quickly the baby comes, and it's not going to change the actual outcomes of the baby coming out. Other folks, mostly obstetricians, argue, no, we absolutely need to continue to assess what's happening with the cervix because we need to know if we should stay or we should go. Because for them, it was kind of like an indicator of how close a woman was to giving birth to a baby. But even since then, that was all the way back in the 1930s, there has not been any very exact, accurate correlation between how far dilated a woman is and how soon her baby is coming. It's mostly just, years and years and years of guesses and patterns and ideas and good hypothesis. So that's a brief history of how long cervical exams have been happening, what people are generally looking for. Now let's talk about exactly what people are searching for once they've got their fingers up inside your vagina. So now we're going to discuss the categories of the cervical exam. The first one, of course, you know it, you live and die by these numbers. It is cervical dilation, and that's measured in centimeters. Cervical dilation is how wide or how open your cervix is. So remember, we talked about your cervix being this closed, tight little donut. Well, it's going to start to spread because, of course, your baby got to come through there, a whole head and a body. So it's going to get more and more open, and that's what dilation is. Just like your eyeballs can be dilated, other things can be dilated. Different tubes or parts of your body can be dilated. It's just the diameter dilation, right? A big circle. The next thing that folks are assessing during your cervical exam is the thinness, softness, or effacement. And that is measured in a percentage. So is it 0% effaced or 100% effaced? I like to describe this like a sandwich because I like food. So if you got this sandwich and it's stuffed with meat, right? And you're trying to just squish it down and pull it apart, it might not. But once you begin to reduce some of that meat and you're eventually left with just two soft pieces of sandwich bread, you can smash them and they probably will easily tear apart. So your cervix is slowly and slowly and slowly getting smaller and smaller and smaller and thinner and softer, stretchier to the point where it is able to fully dilate. So you have dilation, softness, or effacement as you know it. And then we're also trying to figure out where is that baby at? If someone's got their hands in there, they want to try to collect as much information as possible. So they're searching for the pelvic station of the baby. Like a train station, like what stop is the baby at? Most of the times, pelvic station is measured from 3 to 3, positive 3 to negative 3. All of the positive numbers are inside the pelvis. But the ischial spines are two little kind of spots or parts of your pelvis that most of your providers they are able to recognize. And once the baby is parallel to those spots in your pelvis, those little, they call them like a prominence, like prominent parts of your bones, right? Once the baby's parallel, the baby's head is parallel to those parts, then we would consider them at 0 station. Once the baby's head comes below those or comes before those spots, then that's when your baby is in the positive numbers. That means your baby is on their way out into the world. So think of the negative numbers inside your body, like in the building, and the ground floor is 0. That means I got off the elevator, but then I might be going into the basement. That's where life is, in the basement. 1, 2, and 3 are all in the basement. So those are the pelvic stations. So just to recap, we are looking at, in our cervical exam, how dilated your cervix is. So how far open is it? Is it widening? And then we also are looking at your effacement. Gosh, I keep saying we, not me. I promise I will not be looking into your cervix, but your provider is looking at those things. Your effacement, how thin your cervix is or how stretchy it is. Is it getting very, very, very thin and stretchy and opening? That is considered in terms of a percentage. So 0 to 100%, you can be 70% effaced, 90% effaced, right? You get that part. And then lastly, your provider is going to be looking for the pelvic station of the baby. Is that baby far up in there, or is that baby kind of getting that groove in, engaged into the pelvis? Like this. This is my pelvis right here. Engaged in there and on their way out. To the part that you watched this video for. You want to know, what does a cervical exam feel like? So I want to talk about some of the physical sensations of a cervical exam. First, we need to know that a cervical exam is done digitally. That doesn't mean that it's done with a digital device. That means it's done with your fingers. These are your digits, right? So a provider, that could be a nurse, that could be your obstetrician, your midwife, whoever is providing your prenatal care. Typically in the hospital, a nurse is able to do a cervical exam and provide you this full picture assessment, and they're going to report that back to your provider. But everybody's got different hands, right? So you look at your hand, put your hand up, and compare that to my hand. Your fingers might be longer, thinner, wider. You might have a little crooked finger. I got one weird finger right here. So because everyone's hands are different, your cervical exam can feel different based on how that person has to maneuver their hand into your vagina, through your vagina to reach your cervix. In order for someone to get a really good picture of what's happening with your cervix, they've got to be in there and get a few things done. They need to see if they can get a finger and not prod through your cervix, but if they can fit their finger into the opening of your cervix. So in order to do that, y'all, let's just say that your vagina is about this long, right? Maybe go to extra long vagina. But let's say your vagina is about that long. I have to get the fullness of my hand through there so that I can maneuver my fingers around. So that can be quite uncomfortable. Some folks say that it feels like a lot of pressure. It can feel kind of scratchy. It can feel a little bit raw, especially if you are in active labor or if you're feeling any type of contractions. If you also have any trauma around having your womb or your vagina touched, it can be very triggering and extremely uncomfortable. So it's very important that you talk to that person, look them in the eye, and let them know how you feel about this cervical exam. Do you want it done? Number one. How would you like them, if you do approve or give them consent to perform this cervical exam, how would you like them to start? Do you want them to notify you? You know that they're going to be wearing gloves. Do you want some type of lubrication? Would you like for it to be done slowly? Would you like to take a deep breath before? Look that person in the eye. Make a connection with them because they will have their hand in your vagina. At no point in this procedure should you feel like you are one of the 1,000 vaginas that they've seen or touched. This is your body. You will be with it for the rest of your life. And you should know at least the first and last name of anybody who puts their hands in your vagina. So we talked about what it can feel like physically to receive a cervical exam, but let's also look at how it can impact you emotionally. Typically, there is some kind of emotional response to a cervical exam. Now, you might have had a cervical exam outside of your pregnancy. If you've had a pap smear or any type of gynecological care, someone may have assessed your cervix or kind of looked at something that was happening in your vagina. This may feel very different when you're pregnant. So just because you've had one done when you weren't pregnant doesn't mean that you know exactly what it's going to feel like. And usually there are different emotions and chemicals and hormones that are flowing through your body when you're pregnant. So be prepared for some type of emotional response after a cervical exam. Typically, you might feel some relief because there was tons of pressure, or maybe you were really anxious about it. Maybe you were nervous. Maybe it was extremely painful for you, and you couldn't believe that you just put your body through something like that. You also may be feeling some type of disappointment if the results of your cervical exam were not what you were thinking. This is a huge reason why you need to be prepared and knowledgeable and informed about what a cervical exam is and what it isn't. So I want to talk to you about some things that your doulas want you to know. We, your tribe, we got your back. We've been through this with so many moms, and we know exactly how to get you on the other side of that cervical exam. So I mentioned this first. Make sure that you provide your consent and informed consent. If after watching this video you feel like there are still some questions that I have, ask your provider before they perform this cervical exam. What is going to happen? What are you looking for? Can you explain to me what you're feeling for? Don't be afraid to get information before you agree to this cervical exam being done. At no point in time do you have to allow anyone to do anything to your body that you don't want. We'll say that over and over and over again until you're tired of hearing it, and then we'll say it 10 more times after that. You must give your consent. The next thing that you need to know is that even 1 centimeter of dilation, which is usually the average person's finger, this is huge compared to nothing. It is movement. Every inch, every piece of movement. If you've gone a millimeter, just a little bit, that is change, and you're going in the forward direction. So no matter what the assessment is of how far dilated your cervix is, you have to affirm yourself and remember, my body is making progress forward. Remember, this versus this is a very big difference. So give your body some praise. Let her know, girl, I'm proud of you for going from this to this to this, or this, or this. What? Can you do that to your cervix right now? I can't do that. There's nothing that can fit in there. So make sure that you affirm yourself as your cervix is slowly and gradually moving you to where you need to be to meet your baby. Another thing that you want to ask yourself is, do you want or need to be checked at this time in your labor? Sometimes your provider may say things like, we really need to get a picture of where things are. Have a conversation and make sure that you have enough information to be able to properly converse with your provider about why this is a need for you to have a cervical exam. What information is this going to tell us, and how is that information going to change the trajectory of my labor or any of the outcomes? If it does not, then you may not need to have a cervical exam at that time. At any point, you can always opt out of cervical exam. It happens all the time. I've done it in so many of my labors. In my last labor, I had 0 cervical exams and everything went fine. I knew when my baby was coming and there wasn't like a big booming surprise. There's a big difference in how your providers provide care, how they show up to your birth, how are they providing you support. So if you have an obstetrician who has 3 or 4 or 5, I don't know, however many other patients at the same time as you, or maybe they're not even in the hospital at the time that you're laboring, they may feel like they need to have a better assessment of how your labor is going along, and they want to know, how far dilated is she? If you have a midwife who is laboring in with you, meaning that they are with you from the moment that they come to assess you and moving forward. That could be in a hospital. Sometimes midwives labor in hospitals, or at a home birth or a birth center. They may not feel like they need to know what's happening with your cervix because things are moving. Whether I can get a picture of it or not, things are happening. So I don't need to know at every point. It's very important to think of your cervical exam as a progress report. It's not a report card. These are not end of the term grades at all. Sometimes there can be just this looming disappointment, and we hear this language all the time. I was only 3 centimeters dilated. You can't talk like that. You absolutely cannot talk like that. If your cervix was completely closed and now someone can do this, there is no only there. That is huge, substantial movement, and you have to think like that and you have to act that way. But if you don't feel like you can manage the information that you're about to receive, you can receive a cervical exam and you can ask that you not be told how far dilated you are. How far dilated your cervix is does not indicate much. It's just a picture of where things are in that moment. Your cervix can change very quickly, absolutely quickly. Like, I think that I've seen people go from 3 centimeters to 7 or 8 centimeters in about an hour. Things can move that quickly. That doesn't mean that it's going to move quickly for you. Your body knows exactly how fast or how gradually it needs to get you to the point of pushing your baby out. So you need to trust, affirm your body, remind yourself, and get in your mind that your body is doing the right thing and it's only moving forward to get you closer to meeting your baby. The last thing that we want you to know, whoever is providing you this cervical exam has probably seen a lot of vaginas. And we don't want you to feel like you are just one of thousands of vaginas, because you're more than a vagina and you're more than a cervix. But if you feel uncomfortable, don't hesitate to take a moment to make some type of connection with your provider. Know that it can be very easy for them to kind of get out of their head and get into the work that they're doing. So if they begin to be a little too aggressive, or if they're moving too quickly, slowly take a deep breath and let them know, I would like for you to stop, I would like for you to slow down, or talk to your partner about it. Talk to your doula and let them know, I'm starting to feel uncomfortable, or this is something I have anxiety about. But it can be really easy to kind of just get into the mode of things and start looking around in the cervix. They want to get this information quickly. Most people do not want to have their hands in your vagina for a long time, and they don't want to have to put them back in there. The more times that we go in and out of the vagina, then we are moving the bacteria from the outside of the vagina into the vagina and pushing it all the way up to the cervix. Providers usually don't want to do that. So when they're in there, they want to get the best picture so that they can, take all that information out and assess and do whatever they do with. I don't know. Maybe they run lottery numbers with those numbers. Who knows? But make sure that you are very informed. Talk to the people around you about how your cervical exam is feeling. You don't have to have this information after it's done. Maybe the information could be just for your provider and you don't have to sit with it. Don't be disappointed. If your cervix is 3 centimeters dilated, give yourself a high five. It's wonderful. Thank you so much for watching this video. I hope that your mind is now blown about the magic of your cervix. It is incredible. Thanks so much for watching this video. We really hope that all of this information is helpful for you. We are all for informed consent. Make sure that you subscribe to the Chicago Birthworks Collective YouTube channel and like this video, y'all. All right, comment below on how your experiences have been with your cervical exam too. That's always helpful for us to know. Peace.